Hey everybody, we're excited to have Jennifer here today with us, and I'm going to just take a minute to get her connected. And Nell's unfortunately not going to be with us today. She's not feeling well. But let's go ahead and get started and see if we can get Jennifer connected. For those that are just joining, if you can hear me okay, we're going to go ahead and get Jennifer connected. And we're excited to have her as our guest today. And for those that have joined, if you could leave a comment, let me know if you can hear me okay. Can you guys give me some feedback? Can you guys hear me okay? Is that audio coming through? Hey Blair, Dub, can you hear me okay? Oh, you can? Okay, good. Perfect. We've got some improved sound going on with today. You should be able to hear both of us a lot better than before with this new technology that we've got. So great. Thank you for confirming that you can hear me. And let's go ahead and get Jennifer connected here. Bear with us while we just get started. And we're really excited to have you guys. Nell's not able to join us today. Unfortunately, she's not feeling well, but we're looking forward to having this be recorded. We'll be uploading this to our YouTube, and we'll be starting shortly. So go ahead and grab some popcorn or a drink or whatever, and bear with us here for a moment. Where are you guys joining from? I see I got a couple of friends in here, Endatarly and Blaired Up. Where are you guys at? I'm in Utah. Tennessee. Wow. North Dakota. Wow. We've got some guests that are planned. We're booked out through September. We're now into October of next year, and we've got someone from Norway and Ireland. So it's pretty exciting. The weekly lives that we've got lined up for you, and it's just amazing seeing people continue to come together and talk about chronic pain and suffering, and we're hoping that we're reaching out to people and helping them feel less isolated and alone. Okay, bear with me. It usually takes a little bit of time. She's got to go live, and then I invite her in a dual live, and so we'll hope to get her joining us here in just a second. Where are you? Oh, here we are. Oh, let's see. To go live, invite to go live. Nurse SJ78. Where are you from? Got some Tennessee, North Dakota. RN. Does that mean registered nurse? Where? What state? Or where are you? Where are you located? All right, here she comes. Hey,
Hi.
how you doing?
I'm good. How are you?
Good. Can you hear me okay?
Yeah, I can hear myself well.
You can hear yourself good?
I can hear myself like
Is it
after I
echoing?
talk. Yeah.
Is it? Okay.
Yeah.
Let's see here. Let me try something. Bear with me here.
Battery 90%.
No problem. It's I don't think it's doing it now.
Let me turn off the Bluetooth here because I don't think that that's working on these dual lives. I think that it's just letting it do through the iPhone. So let me turn that off just to make sure that that's not causing the echoing while people just a little bit better.
Yeah, there's no more echo. I don't hear it at all.
Awesome. Well, this is pretty crazy.
I know.
You know, I, I mean, as a lot of people, the first time I got introduced to you was with the post that Scott did, but you're obviously so much more than that, right? I mean,
Yeah.
somebody that has a lot of following can help with something like that. But I've been following you and understanding a little bit more about your story with cancer, and you had surgery. And as people that know you well, you really like to do kind of what we see Tina Madlibs and Scott doing, where there's a need to have kind of positivity and goofiness and things like that. But you also recognize the importance of pausing and talking about some of the serious things that people are going through, and you do a really good job at that. So we're really
Thank
honored
you.
to have you. Nell
Thank you
was
so much.
uh, disappointed that she couldn't make it. As you know, I mean, with the Spoonie life, it's kind of
Yeah.
hit and miss. Sometimes we set up there in the room there, and she's just talking with her not being on camera. Sometimes she might join in here. She might join and maybe have a comment or two, but she's just not doing well. So she'll maybe catch the recording. As you know, this is going to be uploaded to YouTube. But wow, it's been a long time. When we started, you know that we're booked out now through September of next year.
That's amazing. Oh wow.
Yeah,
That's amazing.
yeah. So
Congratulations.
weekly interviews, and we've got some fundraising collaboration efforts that's happening with the American Chronic Pain Association and Nathan Osmond that we've got in the works that we'll be doing. At the end of the month, probably the last week of this month, I know you're part of helping turn TikTok purple, right? Back in March when things kind of started happening. That was before we was on Good Things Utah, and you're gracious enough to kind of be part of that, and you posted about that, and that's when I started getting exposed that you even had anything that was kind of in relation to pain. Some people, if they don't catch those posts, they might not know that, they may not see that, right? And so we're going to unpack all that.
Right.
um,
Yeah.
but thank you for joining, for being part of what you have been in the past, and being a huge advocate for people that are out there suffering. um, and
Absolutely.
and I'm going to call you Jennifer unless you want me to call you Mama Dick.
That's fine. You can call me Jennifer. That's fine. Jen, Jenny,
Jen,
Jennifer. I don't care.
Jen.
I'll answer any of them. Hi, KP.
All right. You were also one of the first ones that we reached out to, by the way. I'll have people
I'm
know.
touched.
Yeah. Yeah. So for those that know Misty Marvin, and there's some others, and so we got some things scheduled, but we're not too far out. So I mean, we've got we just continue to book out, but I wanted to reach out to you, and so thank you for joining us.
I'm honored. I appreciate it. Thank
Yeah, you
you.
bet, you bet. And you're all decked out with the pink. Love it,
Hey, I
love
got
it.
my breast cancer
That's
certified.
right. Oh my gosh! And it was just a little over a year ago that
Yep.
you um take how how do you want to kind of go into, for people especially that are new, following you, um why is chronic pain and suffering something that even at that you relate with? I mean, take us back, kind of, did you deal with chronic pain growing up, or was it more of?
It was my mom was a nurse, and my mom and I are super close, so I knew about a lot. She would talk a lot about her patients and a lot about, she had home chemotherapy and she worked the ER. And so, like, growing up, it was we're a medical family. So we would sit at dinner and talk about gross medical stuff. And most
Yeah,
people didn't talk about it.
yeah,
But, I was intrigued by it even at a young age. And so I actually went to nursing school. I started at nursing school, thought that's what I wanted to do. I got all the way to my last semester and I was like, I'm real hard. I'm all about, and you'll know this from following me, I'm all about integrity. I'm all about, like, ethics is huge for me when it comes to, my job. And so I started having a lot of issues with doctors. Like,
yeah,
it always seemed like when they would do something or miss something, it was always the nurse's fault. Oh, well, the
yeah,
nurse didn't get that, or the nurse didn't catch.
yeah,
And I was like, I will be fired from every job I have because I will never allow that to happen. I will be the first
yeah,
person to be like, excuse me, no, it wasn't me, it was you.
yeah.
And so I was like, maybe this isn't for me. So is one day during my internship, I walked by the physical therapist and I was like, hey, can I come in and hang with you tomorrow? I just kind of want to see what you do. And he's like, sure, you can hang with me. I was like, okay. I spent the day with him. The next day I went into school and I switched my major to physical therapy.
Physical therapy. Okay.
And I graduated in 97. And so I've been a physical therapist since 1997. So I deal with a ton of chronic pain patients,
Wow.
fibromyalgia, like a lot of spinal issues, a lot of patients that started with something as a simple procedure and ended up with these massive chronic pain,
Yeah.
scenarios. And so I've dealt with it since 1997. So it personally didn't touch me until cancer, but I've been dealing with chronic pain patients since 97.
Yeah. So you were on the
So
outside, to some
looking
degree,
in.
kind of looking in, but still at the same time, developing relationships with people, and being able to have empathy for them. Um, one of the
And I
things.
heard so many stories where they would come and be like, you know, the doctors don't believe me. They think I'm faking it, or they can't figure out what's wrong with me. So they just threw fibromyalgia out there and said, yep, that's what you got. Cause I don't, we've rolled out everything else. So that must be what it is. And it's frustrating, as a therapist to be like, it
Yeah, that there's
there's
more
nothing I
to.
can do about it. I
Yeah,
can't fix it,
yeah,
but I do the best that I can.
yeah. Well, and when I was on Good Things Utah, one of the hosts had mentioned that they said, that people that you never know what people that are walking by us every day, are going through, and you know that, better than anybody, and that these are
Yeah.
your moms, your brothers, your spouses that are coming
Mhm.
to see you, and sharing some of these stories, and you have an opportunity to kind of have that compassion on them for what they're going through. So
Oh,
you
yeah.
so you you know was in that space for a while, and then what year did that change for you, where it was like, well, wait a minute, I knew that I could always have something happen to me. Now this has now happened. When did that start?
It February 19th, 2020. That's when it happened. That was the day I got the phone call. Now
Was
this was my third mass that I had biopsied. So the third time I went through the fear of what if it comes back and it's cancer, but
Yeah.
it hadn't done that before. So something just felt different this time. I don't know why. I knew in my gut it was. I don't know how or why I knew in my gut it was, but I knew it was. And I remember my doctor called me because my doctor is also a doctor who I treat a lot of his patients.
Mm-hmm.
So we know each other kind of well. So he called me at home versus having me come in and was just like, "Hey, Jen, I got to tell you something." And I was like, "You don't have to tell me because I know." And he was like, "Yeah, it's
Intuitive. Your
cancer."
body just kind of knew.
I just knew. And so he was like, "I need you to be here tomorrow morning so we can get a game plan going." And I'm like, "Okay, I'll be there tomorrow morning." At the same time, I called the Moffitt Center, which is located in Tampa, which is like the best, for breast cancer and
Mm-hmm.
cancers of any kind, and went ahead and set up an appointment there for, just to get the ball rolling. And I went up and I wasn't impressed. I wasn't impressed at all. And so I came home and made an appointment with a local doctor and
Really?
I loved it. Yes.
Gotta get a second
I
opinion
did.
about what they're saying.
And, and I think the problem is when you have a medical degree, like, some things. And so, Moffitt was wanting me to come back 3 different times, once to do my BRCA test, once to do my MRI, once to do, and I'm like, this could all be done in one day. Like, why are we needing to do it in 3 appointments? This isn't something that
Needs to
it's not
drag
like it won't
on.
be covered. Yeah. And so I was
Yeah.
like, I didn't like and I live 2.5 hours away from Moffat. So it's a 5 hour drive.
Right.
And
Yeah.
I was like, yeah, no, I'm not doing that. So I came back here and there was another doctor that had been recommended to me and I went to him in 10 minutes in the office. He's like, why are we waiting? We can do the BRCA test right now. I can have you in the MRI tomorrow. Like, why are we waiting? And I'm like, I don't know. And he's like, do you want to get the ball rolling? I'm like, yep. And he was the guy I picked and I
Yeah.
love him.
And he was
So,
he was the one that was involved with actually confirming the diagnosis and things.
yes.
Yeah.
And so he, was like, we're not going to mess around. We're going to get it in. We're going to get it done. Well, then COVID hit and everything they didn't care that you had cancer or not. Everything just kind of stopped. Hi, friends. And so, you're sitting here and you have it in your body and you just want it out, but yet COVID comes along and is like, I'm just going to
Yeah.
play games with you here. So we then ended up it's the wind, and somebody said it's the wind in the hair for me. Listen, I'm always hot, so the fan's
Yeah.
always on in my life.
Yeah.
I always
No.
get the comments on the hair.
It's just one more
Um,
prop, right? It's the light, the camera.
right?
I don't got my fan,
Right.
guys. I don't look as good. I'm sorry.
But but yeah, so it was a little stressful, trying to navigate it. And
Yeah.
because my mom's a nurse, I've always
Ooh,
had her around with anything
princess.
medical. And so, her having to just drop me off to have surgery for cancer and I had to do it completely alone was awful. That's not something you ever want to have to go through by yourself. But because of COVID, I learned how strong I was, that's for sure. When you got to do it alone, you learn your strength. So,
My word.
yeah.
Nell's, I mean, the tumors, the lacrimal benign tumors that Nell had removed from behind her eye, there were 3 of them. Fortunately, they weren't cancers, but they could become. And if they come back, then they'd have to take out her whole eye. And so, there's a little bit of a scare with cancer. She doesn't have a lot of her pain, cancer related, right? She has the central regional pain syndrome. And interestingly, chronic pain and suffering, right? It's a category that is pretty inclusive of a lot. I mean, there's similarities there that are helping bring
Mm-hmm.
people, closer together, but there's so much diversity within just that. I mean, we've had fibromyalgia, I'm not even saying it right, endocrinology, um, the endocrine, system, whether it's adrenals, whether it's, we had somebody that was cut all the way up here because they had some part of their, there was some bone spurs that were causing some brain fluid to leak. I mean, there's just been all sorts of kind of things. Even the pain that comes from losing a loved one. I know that you lost your best friend or one of your best friends in the past. We've had some people on here with mental and emotional. It's just been amazing, but we haven't really talked with someone about the pain that comes from cancer. So aside from the blow, I'm sure, and the grief, right, that you start going through of the acceptance of your new life, and the grief that can happen as you are trying to let go of how life in some ways were. That is pain in of itself, but does the physical pain come into things during chemotherapy? I mean, if you don't mind me asking, how does
I'll
pain?
tell you. They told me when I met with, it like happens so fast. You meet with your oncologist, then they send you to a radiation oncologist, then they send you to a medical oncologist, and then they send you to a surgical oncologist. So I've got all these people, like, you know, all of these appointments, and I'm not knowing what to expect because this is something I never thought would
Done
happen to
before,
me.
yeah, yeah.
Um, but then I remember the radiation oncologist saying, like, you I don't know what you're going to feel because some people have pain after their second radiation treatment. Some people have no pain. Some people have an infection in the skin. Some people don't get an infection. Every single body's different and you're not going to know until you go through it. But, I had 20 rounds of radiation and they try to do it 20 days straight, weekdays straight. So it's Monday through Friday, Monday through Friday, Monday through Friday, till you get to 20.
Wow.
And yeah, and so I was super afraid of, what was going to happen. And, I went in and they're like, today you're coming in to get your tattoos. And I'm like, tattoos? Tattoos for what? Like, what are you talking about? Well, they tattoo you. So I have a tattoo on each side and one tattoo in the center. And that's where they line the lasers up to be able to do the radiation. I didn't know this.
Wow. I didn't
And then
either.
I had to go in and they do a body mold. So they have you lay on the radiation table on this really funky liquidy pillow and it hardens around your body. So every time you lay down, you're in the exact same position. So they know it's exactly lined up. So they know they're getting the exact spots right every single
Oh,
time, which
okay.
is kind of cool.
Yeah.
Um, so I went through that and I did probably the first 10 treatments. I was fine. I was like, I got this. This is a piece of cake. Well, it builds up in your body over time. So by the time we got to like the 12th visit, I was like, I don't feel so hot. I was super tired and super drained and just felt, uncomfortable, but not too bad. So
Yeah.
I made it through the rest of radiation and I was like, oh, I didn't have any infection. I did great. Everything's fine. This was okay. I got this. I had this.
Yeah.
And then 2 weeks after radiation, I wake up and my skin is all opening and I've got all these burns. Like I was like
Oh.
6 shades darker than, well, I was about like this color. I was like this brown color here, like my entire area. And I was like, whoa, that doesn't look right. And so I went to the radiation. He said, yeah, what happens is the radiation then comes out. And with everybody,
Oh,
it's
to
different.
release,
And
really.
so yeah, the burns was the radiation coming out and it was burning my skin and cracking my skin. And so I ended up with lymphedema, which is the inflammation of all of the lymph nodes underneath my arm. And so
Mm-hmm.
it caused my arm to swell and everything to swell. It was super painful. So I had to go 3 times a week for lymphatic drainage therapy to kind of push the fluids that normally would go out the arm, had to retrain them to go out the leg. So that was not fun, but it had to happen. And then shortly after that, I started having like severe back pain and ended up with emergency
Yeah.
spinal
Yeah.
surgery.
I saw that video. You were already kind of in surgery, but then they said, "Well, we've got something else that we've got to do," because they discovered the your double herniation, right? That
Double
was happening.
herniation, yeah.
So that was
So
something
I
that
ended up with
was like
I
side
something I totally didn't expect.
blindsided you, right? Because you're like, I'm trying to fight cancer and have it not kick my butt, and now you're telling me I got to deal with something with my spine, right? And the nerves that were impacting what was it the sciatic nerves or something?
Sciatic
Sciatic
nerve, yeah,
nerves.
it was like it was pushing directly, it was pushing on the spinal cord one way and then on the sciatic nerve the other way. So that's why the pain was so unbearable. And I just couldn't take the pain anymore. Like, and my husband's like, I can't watch you pass out like one more time in pain. Like you're going to the hospital. So,
But that wasn't related to
I went.
cancer. It's just that happened to just be coincidental that was found.
And the doctor said, more than likely, radiation makes your muscles weak. So they're not supporting the spine like they should. I'm still trying to be super mom. It's Christmas time. I'm moving presents. I'm lifting stuff. I'm putting up trees. I'm doing all the things that, moms would do. And my muscles just were very, very weak. And so it wasn't giving my spine the support it needed. And more than likely, that's kind of how it happened. So was it directly related? No, but they think, because the radiation made me weak, that ended up happening. So
if we looked at just the cancer, my brother-in-law, my wife Nell's brother, older brother, died of cancer, and I've always kind of wondered, I don't know if people just don't seem to like talk a lot about things that are pain related, for a lot of reasons, and we've kind of been learning those reasons, whether that's asking questions and having it come across as questioning. You're feeling helpless and you want to propose some solutions, but then you don't want to have that person worry about that. Oh, I've got to take it on myself to try all these solutions. It's hard, and it's been good to watch people talk about it on these interviews. It's been good to hear some of the different reasons why they haven't maybe in the past. But to not understand, if he didn't do any treatment, right, and just the cancer itself. I mean, of course, it starts growing and the discomfort, and it starts impacting just the functioning of organs, and that's got to impact your nerves. But if you didn't go to chemotherapy and you didn't have anything wrong with your spinal, does the cancer and being there and growing itself cause pain, or is it just
well,
you know what I mean?
every cancer is different. Breast cancer is usually not found, like it's not painful.
Okay.
Breast cancer is usually discovered through a mammogram, which mine was. I had no discomfort. I didn't feel a lump. I did my monthly test. I felt nothing. I just went in for an annual exam, and they were like, "Oh, we found something."
Yeah.
I had no idea.
Okay, yeah.
But I think that's very different than
lymph
say
node cancer
ovarian
or something,
cancer, which can be it's very
thyroid
different.
cancer or whatever. Yeah.
Exactly. It's so breast cancer itself, that's why everybody emphasizes like get your mammograms, because most times they don't even know it's there. You don't feel it.
Yeah.
You don't feel it until it's really large in size, and by that time it's usually pretty far along.
Yeah.
I was lucky. I'm because I'm in the medical field. I didn't never missed a mammogram. I'm like 1 year, 1 day I'm there, because I know, and so thank God I did, because who knows what it would have been in 6 months, because it was a rapid growth tumor. When they send it away, they do testing on it. They take the cancer out and they send it to a place called Decision RX, and it basically breaks down that cancer and it tells you what the chances are of it coming back without radiation, with radiation, and like with chemo, without chemo. It like breaks it down for you. And with the radiation, it was 8%. Without, it was 38%. So
really?
It was a rapid grower. Yeah. So there was no
early
option.
detection, radiation. There's going to be pain involved, whether that's because of natural or things that are brought on because of the treatment. But that's a lot better than the alternative.
And the thing with me, and this has been most recently where I started talking truly about the pain and the frustration post-cancer, is, once the cancer was out, everybody's like, yay, she doesn't have cancer anymore, she's good. Well, I have to take a chemo drug every single day for 5 years. And once I hit my 1 year mark on this chemo drug, I now have pain in every joint in my body from the time I wake up in the morning till the time I go to bed.
From
And
this
it's from this chemo
side,
drug.
the
It
side,
attacks your joint.
the side effect
So
is
I
that
wake up and go ahead.
is that so that the medicine that you take for 5 years, is it planning? Is it anticipated that it will keep that pain, that joint pain, going even after, or is it just that you're experiencing that while you're taking the medicine?
You're experiencing it with the
What
medication.
medication?
But the medication's necessary because it stops estrogen. And my cancer was estrogen positive. So it's stopping my body from producing any estrogen so that the cancer doesn't come back.
Yeah,
So if I stop taking it, my chances of it coming back are so high that I'm like, well, I'm just going to have to deal with the pain. You know what I mean? Like it's
yeah,
just, and I don't think people talk about that because I didn't know that that was even a thing. I didn't, and I started Googling it and I'm like,
yeah.
everything I Googled, 90% of the women that take this drug have severe joint pain. And
Did they let you
I
know
didn't know.
that that was going to be? I mean,
No,
yeah. So it's kind of like it's in the fine print, but otherwise, discovering things on your own, right? Because you're the one that's going to care more than anybody. So,
exactly. Yeah. But I had no idea. And so I said to me, the frustration part is, my whole family's like, she beat it. She doesn't have it. She's good.
yeah,
And I'm over here like hurting all the time. And it's like, I try not to burden my children with it. I don't want my husband to worry about me. So you just kind of like deal with it.
yeah,
And it's frustrating. It's nobody tells you about that part. Nobody tells you that just because it's gone doesn't mean that you're not still suffering and
you're
dealing
not
with it
still
on
dealing with
a
it.
day-to-day basis. So,
Yeah, that's not just like it's cured and you're out of the woods by any stretch, right?
right.
Well, Nell's life changed so much. We've raised 3 kids. They're out of the house now, right? We've got our little granddaughter that we watch, and she has been so involved. She still is. She's been, raising them. She's been able to stay at home. We've been active in serving the community together often. And her life has changed to where she's serving, but it's very different, right? It's remotely. It's you know um and she's in bed a lot, right? And she's been disabled in to a large degree, and along with that comes isolation. And if you haven't heard already, part of why we're kind of doing all this and the movement to YouTube and the spoonful of sugar and the whole spoonie theory is she's like, you only have so many spoons. If you're going to give those spoons out, have it be a spoonful of sugar. And so she's still helping people to think differently about how they can still be of value in the world, right? I mean, so many people when they're isolated, they're like, okay, well, I guess I can't serve the way that they want me to serve, and so I'm kind of worthless or whatever, and so she's watched a lot of YouTube people, several that have died after she has been following them, and that really inspired her, and that's kind of why we're doing this, and we'll have our spoonful of sugar nonprofit finalized and created here, not too
That's
in the distant future. But what kind of isolation, and you strike people as someone who is like that in so many ways. You're involved with your kids. You're go go go. You want to be the best mom and the best wife and not be a burden. And that's all well and good. And when we have our health, right, and we're not dealing with something, but when life has something else in store for us for whatever reason, we're having to face having what's going on in us impact our loved ones, and having what's going on in us impact our loved ones, and did you have to
I
go
hear you.
like weeks and months where you're like, hey, family's just not even, I just need to be by myself. I mean, there's a lot of behind the scenes that sometimes, obviously there's a lot that we don't need to share, and there's always an appropriate, scope of privacy. But talking about that, especially on social media, has been very powerful and being like, wow, I mean, Jennifer had, Smiley Jennifer had moments where she just felt like in despair. Wow, if I, if she can do it, I can do it, this kind of thing. So tell
Yeah.
me a little bit about that part as you were going through this.
I think the hardest part for me was I'm that mom that just does it all and I don't ask, you know what I mean? Like I just do it. Like I just, you know what I mean? Like I just do it. And so the hardest part I think for me was to have to sit my kids down and my husband down and say, "Listen, I can't do it. I
Yeah,
can't do it anymore. I need you to step up. I need you to pick these things up that I can't, and it's the very hardest thing for me is to have to ask my kids to step in and be mom, you know what I mean, and take
yeah.
on the things that mom's always done. I don't you just don't want to do that as a mom. You want to
Does
just be able to do it all, and
does
I knew I couldn't.
did it make you? I know that sometimes Nell has talked about that, and we've all tried to reassure her that no, it's you're not a failure, right? You don't have to. But do you feel like that? I mean, you feel like there's no excuse, right? It's like this isn't really an excuse,
It,
and
my biggest thing, and I don't even know if this will help you, and is I felt like a burden.
oh, okay,
If you do it yourself, you got it. But if you have to have other people do it for you, then I felt like I was burdening them. And it's not my job as mom is not to burden them, it's to take away their burdens. You know
yeah,
what I mean? That's how I feel. And so I felt like such a burden on everybody. Like every time I'd say, "Hey, can you come get this? I can't do it." And they're doing homework and they have to get up and come and do it. I felt like such a burden on them.
no,
And I think that was the hardest thing for me. But I didn't have a choice. Like there were just things I just simply couldn't do anymore.
yeah. Well, and even if you're not a burden, even in the sense of, that you're talking about, where you're feeling, bad about it, guilty about it. Um, it's interesting because just the challenges that can come up to your kids or your family or your husband if he becomes a caregiver for however long, even if we don't talk about it in the context of that it's whether it's a burden or not, the reality is that they're having to learn how to accept it and cope with it and grieve, and so those aren't things that you have to kind of be like, oh, I'm a burden, but they are still, I think, important topics, and that's okay that they can be allowed to have those times where they're like, you know what, this okay, maybe this is a little bit harder over here, right, where I had the luxury of having mom do it, and now I'm having to adapt or maybe mature a little bit faster than some of my I'm seeing my peers have to,
Yeah.
and maybe that's not fair, and maybe they have a moment of being angry, right, maybe not
Oh, they
for
had moments.
yeah, and
I remember my daughter one day I was like, I need you to do this and she was like, why? And I was like, because I can't. She's like, I know, you have cancer. Like, you know
yeah,
what I mean? And then she
yeah,
was like, I'm sorry, I didn't mean that.
yeah,
And I'm like, it's
exactly.
okay. Like,
Yeah, and
you're
these
allowed
are
to be mad and
yeah, and
frustrated.
these are the people that we love. These are virtuous, good, souls, but we're human, and so you know it's been really healthy even for our family having these kinds of conversations because it's helped for us to be more okay with and even talking about what we wouldn't otherwise just sit there and talk about, right? It's not like it's like let's get around the dinner table and talk about what I'm going through because of your illness and how is this impacting you, kids. I mean, you may do that, but maybe a lot of families don't, right? You go through a lot of it
Right.
probably. you know you kind of maybe keep it to yourself or maybe you confide with a
Day by
friend,
day.
but
Yeah.
and
Well,
so
I found out like probably 6 months later that my son every Friday night was calling a group of friends and they were praying for me every Friday
oh
night.
wow,
And he didn't tell me until later, but I was like, wow, this is a 16-year-old boy and he's doing I had no idea.
yeah,
And my daughter, was confiding in people at school like her frustrations and what she was dealing with because she didn't want to take it out
that's
on
yeah,
me. And
exactly, that's
so I
what I mean,
these
yeah,
things after the fact, and I always say, like, and I always tell, since I started talking about it on TikTok, I cannot tell you how many people have inboxed me. They found a lump. They're waiting for,
Yeah.
whatever, asking, like, how did you get through it? And I always tell them, listen, my big thing is you always, it affects your family just as much as it affects you. And you have to remember that. Like,
Yeah.
everybody's dealing with the cancer, not just you. You may be the one that
Yes.
has it, but everybody's dealing with it.
Oh,
Everybody has
oh,
their
that's so
own
true.
piece of, and you have to remember that. Like, so they're gonna snap and they're gonna yell, they're gonna get
Yeah.
frustrated,
Yeah.
they're gonna have moments where they say, I need to just, can I have 5 minutes,
Yeah, it's gonna
and
it will affect
don't,
it's a
yeah,
it can it will affect your marriage and
yes,
marriage has its own challenges even of the best of us, and so then if you introduce all of those things, then it's like, okay, how are we going to navigate that so that we're still being as healthy as we
stronger.
can, and so my heart goes out to not only you and your family, but to other people that and I think that uh, allowing for ourselves to kind of have that vulnerability is where I say I've said before, it's where we need to just really practice grace with each other. I mean, uh, those moments where your child might have snapped at you and you're like thinking, wait a minute, I'm not deserving of that. Well, let's try to have grace and not make, because I it's interesting if you look at any kind of unhealthy destructive cycle that happens, right, whether there's health issues involved or whatever, it's um it's always continuing and perpetuating because there's vice and weakness involved. And whenever you break cycles and you have progression or growth or people getting through something, surviving, right? You talk about being a survivor and a warrior. It's because people are introducing and increasing virtue and strength. And that's not always fun. It's not always fun to acknowledge, you know what? I've got these vices, I've got these weaknesses, and I'm being an ass right now. And this person does not deserve it. And so I need to, decrease my vices, change basically, improve, get better. And you can unpack that, and it gets really complicated with what that all looks like, and we all have different weaknesses and strengths and all of that. But it forces us to grow, and it doesn't always feel good, but a lot of good can come from it.
And I'll tell you something I learned too, being on here and talking about it, you get a lot of people reaching out to you, like, I found out, so and so has cancer, can you reach out to them and support them? And I'm the first person that'll go and just like message me, call me, this is, I'm here, I'm there,
Yeah,
and then you see, like, you know these sweet little precious babies, like we all know, passing away. I
yeah,
didn't realize that survivor's guilt was a thing either. That's something nobody ever talks
yeah.
about.
That's true.
And it hit me hard, like hard, when a couple of these sweet babies passed away. And I'm like,
Tessa,
why
like
am I
baby Tessa.
okay? They're
Yeah,
gone.
yeah,
They're precious little babies. And when I tell you, sometimes I would lay in bed and cry for days, and I didn't understand, like, why I was so grief stricken. Like, it's a child, of course I'm a mom, I'm gonna be grief, but it was
yeah.
so much deeper than that. And somebody messaged me and said, survivor's guilt. I'm like, why do I get to be okay and they don't?
They
Like,
don't. Yeah,
why did I
it's
make it
not
and they
fair.
didn't? And no, it's not.
Yeah. Well, it's like with what the Chad's going through with Mia. I mean, she's
Exactly.
it's like, yeah, she's going through that, but then she's having a better outcome, at least, that what's happening than what happened with baby Tessa. On this, and so it's just even just
And baby
watching.
Tessa was the hardest, I
Yeah,
think,
it's
for me. Like,
heartbreaking.
if there's a couple, the day she passed, I think there was a video that I posted, and it was like I was sobbing so uncontrollably. Like, that was that day, and probably for 2 days after.
Yeah.
I I couldn't even get on TikTok because I just couldn't stop crying.
Yeah.
And then that's when I realized, oh, okay, this is a thing. This is a real thing, and I didn't even know it was.
Yeah, well, I mean, I'm just blown away. I mean, Facebook and Instagram and all, that there's a place for that. TikTok's been huge, and people getting to know each other. I mean, it's like I tell people that all the time. We start having an interview, and it's not like a who's this person and I don't know you. It's kind of like, oh hey, I mean, just as if we were like in college or
Yep.
working, and because you know their lives, you're following each other. You're like, oh yeah, I know that person. I know that. It's like it's like with what everything that's been happening with Tia. I mean, I just she's been able to recover, and a lot of whereas Nell had a friend that died, right? And it's just insane because some things have more of a positive outcome and some not, and it can always change, right? All of our stories can change. I think that's
In a heartbeat.
it. If you're watching this, and it doesn't matter how healthy you could have, the best fit healthy body. We're all here temporary, right? I mean, you're not going to
Yeah.
have that forever, and so even if that is where you're at, you know finding things that you can benefit in being part of the conversation, knowing that it's really just kind of a matter of time for you or for somebody that you care about to go through something and have it change your life. And one of the things that I think has the power to destroy lives is grief. Grief is just a really brutal thing, to try to cope with. Um, but you're pulling through. I mean, here you're what, a little over a year out, and sounds like a pretty optimistic prognosis, and
Yeah.
that's good. The surgery went well with the back, and right now you're not living in a lot of pain, but you kind of went through. Is that do you
I have
still
pain every day.
okay? And is that because of the medicine that you talked about, or
Yeah.
it is?
The medication that I'm on just kind of.
You're still on broadcast?
Yeah.
Okay. Never mind.
Sorry. The medication that I'm on still, like I said, and then I went and saw a pain specialist, and he basically said, well, you have your option to stop the medication, or you're going to have to just deal with this pain every day.
But that's
So I just
how long are you taking that though? Didn't you say 5 years?
have 4 more years.
Oh,
I
okay.
have 4 more years.
So it's planned to have that be short term, right? I mean,
Yeah. Well, 4 years feels like an eternity right now when you're
that's
hurt.
true.
Yeah.
True.
In the long run, 4 years isn't that bad, but it feels like an eternity right now.
Yeah.
But
Well, what would you say to those that are just barely kind of going through some? I'll kind of rephrase it. Right now, it's because we talk with people so frequently, we meet people all the time that are going through similar things. But before we started doing this, and it's shocking to even still say this, but I don't know if you follow. If you're not, follow Misty Marvin, imperfectly perfect.
I follow her.
Yeah. So when she did her post about chronic pain, and I kind of responded to that. That's how a lot of this started, and she started helping with a lot of it. That was the first time that I really kind of got exposed like that to someone else that was experiencing that. And then shortly after that, when we interviewed one of the caregivers, a spouse, that was the first time that I met in probably 15 years, maybe more, anybody like that. And so I don't know if people that are watching this can relate with that, in that that's great that there are people that are starting to come together and they're not feeling alone. But there was a time when I felt like I did not have any idea how many people out there were going through different things. I have never been able to talk to anybody that could say I've got somebody that I love that deals with that every day as well. And that seems kind of shocking because now I'm so into it
Yeah.
it's not that. But I know there are people
I
out.
feel like people are starting to talk more. I feel like
Yeah.
people are starting to acknowledge, like, I say all the time, like, nobody ever talks about when you lose a child, when you miscarry. Like, nobody ever talks about that.
Yeah.
And I'm starting to see more women reaching out when they've lost a child and
Yeah.
talking about it. And I think it's important because when you go through something like that, which I have twice, you feel like you are completely alone.
Oh,
Nobody understands what you're going for. Nobody knows what you feel. Nobody gets it. And you look at the statistics, and a lot of people
people do.
go through it, and a lot of people know how you feel, and a lot of people get it, but nobody talks about
Yeah.
it. And so I think this app, more than any app ever, is talking about it. They're talking about
Yeah.
mental illness. They're talking about chronic pain.
Love
They're
it.
talking about every type of cancer out there. They're talking about it, and that's what we need. And that's why
Yeah.
this app, I came to this app. I came to this app to get me through radiation, to laugh, to have a place to go. And then once I got through it, I'm like, I want to be someone on this app that is there. I don't
Yeah.
ever want anybody to fight alone. And I tell people all the time, if you have a friend that's diagnosed, send them to me.
Yeah.
Tell me who they are. I'll go to their page and like their stuff. I'll message them. Like, I don't want anybody to feel alone ever when they're going through something like this, because you're not.
Yeah.
You'd be shocked at how many people are going through
Yeah.
it.
You're
And just
absolutely not alone. Yeah.
you're not alone.
There's a lot of people that aren't even on social media that don't even, they're just isolated. There are people in hospitals. There are people that check out. That suicide because they don't ever get to the point where they're seeing that there are people that care. So yeah, absolutely. I hope we're making a difference, and I know you certainly are. And again, it's just we're stronger together, right? So we
1,000,000%. And this app has blown my mind. I joined something called the Love Rally, after I went through, and we would do, what we call love rallies on Sundays, and just go into people's lives and love slap them.
yeah
Just spread love, spread
yeah
positivity. And,
yeah
we
good
ended
old
up
M
doing
dudes.
auction for, I don't know if you remember, we auctioned off a bunch of
I saw a post that
TikTokers.
you were saying that. I
Yeah.
didn't get all the history. You're like, I'm getting ready to be auctioned, and I'm like, what is she about? What's going on there?
Well, what I was raising money for is there was a veteran, a young woman who needed hearing aids and was having a hard time getting it. And we wanted to, she had a little girl. She had never heard her laugh. And, that was something that weighed on my heart. And then there's another TikToker on here who makes blankets for families of babies who have passed away out of
Yeah.
their clothing.
Yeah.
And she doesn't charge a penny for it. She does it for free. And I know that stuff's not cheap. So for me, when they auctioned me off, I split it between the two women, and we were able to get the hearing aids
Oh,
for
that's
this
cool.
veteran. I was able to give $1,000 to this mom to help make blankets, and it makes a difference. And
Yeah.
right now I'm trying to help a domestic violence situation. I'm trying to get a mom out and her 4
Yeah.
kids out of a really hard domestic
Yeah.
violence
Domestic
situation.
violence
And I
situation.
turned to TikTok, and so far we've raised $2,000 for this family.
Oh, that's amazing.
And
yeah.
So, and I'm not done yet.
Yeah,
what I
just
mean?
a huge advocate. I mean, even just what you did to End Pain Stigma just joined us. We're gonna be interviewing her later as well. She's joined on my end. Follow her if you're not already. End Pain Stigma. Follow Mama Dick, and then make a note of End Pain Stigma. She's a huge advocate and one of the pioneers. A lot of people don't know the American Chronic Pain Association, right? And those that they're who we're collaborating with, and we they're like a 40+ year veteran. But End Pain Stigma is kind of like one of those additional leaders. There's people out there that are really advocating like you're talking about here. But one of the things I really love about your advocacy is you've got a soft heart where you just are drawn to anywhere where there's that need. I mean, like Matt Blackstock, right? I mean, the post that you did, and you're like, hey, you're not here with us. We interviewed him, and oh, melt my heart. We are buddies for life. that
Yeah,
guy.
I love him.
Yeah, and and autism, and you helping turn TikTok blue, and so you're actively looking and genuine about it, right? I mean,
It means everything.
there's a lot of
I
bad
want
apples in the
conversations happening.
a lot of bad apples in the world, and so it's just refreshing to see someone like yourself who really has a genuine heart, and you're authentic about your own story, but you're also you know living the spoony even the spoonful of sugar principle, where you're like, dang it, I'm a warrior, and this isn't going to prevent me from the times when I can be the mom that I want to be, and I'm going to reach out to the people that I can see are, maybe feeling, befriended and things. And there's even a place for Vegas, for crying out loud. I would have loved to have gone. Of course, I couldn't have been there because of Nell, both them and Friendsgiving, right? So different events like that I'm not able to just kind of take off. But boy, you had a blast, and there's a place for that too, of
So much fun. Yeah.
just the camaraderie that
And
comes.
I loved that I went to Vegas not knowing, but finding out about Felicia. I don't know if you know Chief Nitro's wife.
Yeah,
Felicia was diagnosed
yeah,
with stage 4.
yep,
And we found out right before Vegas, and I reached out to her, and I was able to go there and hug her and sit with her and
oh
talk
my
to her.
gosh,
And I feel like it was meant to be. Like,
yeah, really,
now we're, she's my girl. I message her, I want to know how she's doing. Like, yeah.
yeah,
I
because
sent her
it's
a care package.
brand new for them, and you had already
Yeah.
gone through, yeah. Oh, that's awesome.
And so I feel like that was meant to be. You know what I mean? Like being
Yeah.
able to go there and see her and sit and talk with her. And I ran into a couple other people there that, I didn't know, that were like, hey, I'm a breast cancer survivor. And we were able to sit and talk about it. And
Yeah,
it was a great experience. And like, I can't wait to do it again.
and the reason why I like talking about that is because, whether or not you're getting into the little bit more of the seriousness of just the conversation, or whether you are doing the silly things and the funny things, they're also what I would call kindred spirits, and they get the reason why they're doing that. They're playing an important role. They know people have pain. You don't think there's pain behind Scott and Tina's lives, and so it's a gift that they have that's unique, that we don't all need to be like. We don't need to copy. It's part of what they are really good at, and it has the same love behind it, right? It's kind of like, hey, I know your life sucks right now, or this, or you're feeling like, you're watching what's happening in the world, and I mean, I literally told Tina she is funnier than any person on SNL. She is the
And
funniest.
she's genuine to the core.
Yeah.
Off of TikTok. Who you see on TikTok is who she is off of TikTok. She is. I mean, my daughter's big into theater, and she and I were doing a FaceTime, and I was telling her, like, my daughter's flipping out and she was like, well, if you ever want to do a duet, we'll do a duet, we'll do a Broadway duet, we'll sing together, we'll, supporting my daughter who, she's 13 years old, and she's here, like, she doesn't have to do that kind of stuff, but her heart, she just has a great heart.
Exactly.
And, Scott's whole thing, I don't know if you know the background. Like, I did that video for him. You know why I did the video for him, right?
I don't think I do. Take us back to the duet video.
So the whole I got on TikTok because my kids were on TikTok. And all my kids' friends call me Mama Dick. When I walk in the room, it's Mama Dick. So that's why I picked the name Mama Dick.
Yeah.
Because I knew my kids' friends would know, that's Mama Dick, we better watch what we're doing. You know what I mean? And I would comment on their stuff. Hey, take this down, it's not appropriate, they know me. It's the whole reason I got on. Well, I found Scott. And so when I would go to my radiation treatments, I would go 15 minutes early, and I would look at Scott's videos, because I would feel good going into radiation.
Yeah.
And then I would come out of radiation, and I would sit in the parking lot, and I would watch his videos, watch 15 more minutes of his videos before I came home, because I wanted to be smiling when I came home.
Yeah, it's a pick-me-up.
And he got me through. He literally got me through radiation. And so when he went through that whole bad time, I was like, I'm not okay with this. Like, I'm not okay with this. And so that's why I made the video, because he was going to leave. He left TikTok, and I'm like, people don't understand. man.
Oh, the
He's getting me
meanness.
through.
Yeah,
He's getting me through the toughest time in my life. I need him. Like I need him. And
yeah,
it was for real. Like I desperately needed that laugh every day. And I'm like,
yeah,
he can't not be here
yeah.
because he's literally getting me through something. And so about 2 months after I did that video, maybe three, I was live one night and he love slapped me. And I lost it. I was sobbing like
Oh, I
because I
remember. I
just
saw you
wanted,
posted a little bit of that. I saw a little bit of that.
yeah,
Yeah,
I just wanted to be able to tell him what he did for me and to not listen to all of the negative people that come in and have things to say. Like,
yeah.
remember that you're changing lives. As silly as it is, your wheezy little laugh and your big old grin changes
Oh,
people's
it
day.
is. It's powerful. Yeah,
And yeah, so that's the whole how the video even came to be about is because he got me through.
yeah,
And I've told him I will forever be your cheerleader. I will forever be your biggest fan. I will forever be here to support you and Holly because you honestly got me through the most painful and toughest time in my life.
yeah. And really made himself vulnerable because you do stuff like that. It's kind of like that kid that's got a big heart and he tries to do stuff like that, and the high school kids would just rip you apart. It's kind of like the adult equivalent of that,
Hmm.
and good for us to say, hey, look, man, we had his back, and like, no, 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 you're not going to do this. I mean, there's a
Yeah,
lot of
exactly.
really bad, mean people out there, and I don't know if you've got a lot bigger following than we do. We haven't gotten a lot of that. I don't know if you have, but
I haven't.
I'm just waiting for the day. I don't know if it'll ever
Me
happen, but
too.
I haven't had to do blocking and things like that. But I could not imagine what that would be like to
Yeah,
actively. The Chad does like so much
constant.
blocking. He's got,
Yeah,
yeah, and I don't know if I want that in my life, but I know he didn't ask for it. But yeah, I mean
yeah,
that they and and I I just love how they know how to um, basically, you know, why do people want to be cheered up? Why do people want to smile and feel that positivity? And again, it's because they've got some stuff that's painful in their life, and so they're no different than
no,
they're no different in that it's not like um, you know them or anybody are doing that because they would ever want to make light of something that's serious. They're brilliant in that they get that that's the way that they're contributing, in a big way, in ways that I couldn't ever. I mean, I'm no Scott or Tina for sure. So
no, me either.
but in fact, I even told them uh, Alexandra Bastion. She's an artist. I don't know if you follow her.
I follow her. Yeah.
Yeah, but we interviewed her. She's a good friend of ours, and um, her story reminds me of yours a little bit in that she went through a period where it was just heinous. She almost died, and she doesn't deal with that as much. But when we had her on, and as I was getting to know her, um, even myself, I mean, the perception is like, hey, this is great that she did a tribute to Nil. She created an art piece that was part, um, and she's now going to be she's part of, now that COVID's been released a little bit. She's hosting a body makeup kind of competition event, I think, up in Canada. But anyway, I I say that because she had her unique way of also. I mean, all of the painting that she does and that she puts out there, she wasn't saying a word about what she went through that almost killed her years ago. But come to find out that again, she has that same empathy that you have and that heart, and she's expressing that in the beautiful way that that she does. So what a good thing. What else you want to talk about? Wow. any questions that your followers have, or that anybody on my side that you guys want to ask
They're all
in?
over here like, she just beat COVID. I'm fighting a kidney stone. There's all this other stuff going on, and I'm just, yeah. I find like when I'm hurting, if I can just put my energy someplace else, it like takes away from
Yeah,
having to deal with my current, you know what I mean? Like it's like, I don't know, it gives you like an outlet for whatever you're dealing with. And
yeah,
so right now my outlet is this family, trying to help this family and um,
yeah,
get them to safe
yeah.
haven.
Well,
Like
I
that's
knew
my
you was up to
focus right now.
something. I knew you was up to something. We were fortunate enough, actually, where Nell was feeling well enough, where we just got back from Park City. We went out, all of us kind of
I
went out,
love Park City.
and so we did. It was amazing, great food, and we was on a lift, and Nell was able to walk around and things, and participate with
That's
it and laugh.
amazing.
Yeah, it was pretty amazing. Um, and it was around the time that I was reaching out to you, just kind of confirming that we're a go, right? And it took a couple of hot minute to have you kind of confirm it. And I know,
Yeah,
but
sorry.
I'm like, it's, I know she's up to something. And come to find out, you did a post, and you're like, I've been busy helping
I've been
someone.
going from like 6 in the morning till
Yeah,
10 at night, just trying to like find resources and just
yeah,
trying to help this family. And it's,
yeah. So it warmed my heart knowing that, absolutely, not only did you confirm, but you were also, kind of sharing, as humble as you were, that you're helping her, and she's in a lot of pain with what she was dealing with her domestic violence situation, and that's still ongoing, right? I mean, that's something that you're still trying to support her in.
yeah, like I've got her out of the home. I've have her put up in a hotel. I have her stuff in a storage unit, and I took her today to low income housing, and we're waiting to find out if she gets approved for the apartment. If she does, then I have to come up with another $2,000 to be able to cover her deposit and all of that kind of
To
stuff.
help
So
her
I'm
out.
actively still trying to, we're doing fundraisers around here. Like I've turned to TikTok to try to, get help. And I've been
Yeah,
shocked by the amount of people that have shared the story and have tried to help, and have sent
yeah,
money. And, you know, my big thing is I've never come on here and asked anybody for it. And so that's hard for me in general.
yeah.
But, this woman's son is staying with me. I've put him in my home.
Oh,
Um,
wow.
and I showed him the comments and I've showed him and I'm like, you need to understand that you've seen a lot of bad in this world, but I need you to look on here and see the good.
Yeah,
Because there are so many good people still in this world and they're trying
yeah,
to help you and they don't even know who you are, honey.
yeah,
And they're trying to help you.
yeah.
So he's staying with me and then another one is staying with another friend. So she just has her and the two youngest in a hotel right now. And we got her there until next Tuesday, but then funds are gone. You know what I mean?
Yeah.
So it's been a tough couple weeks, but we're gonna get her through it and we're gonna get her where she needs to be, and then I can breathe and take a break.
Yeah, no,
But
I
I'm
think
not until it's done.
that's so amazing. I love hearing, we've talked about how people go and they go into their local communities, and they, whether it's continuing service like you just did, you're saying, or whether it is starting conversations for the first time in their families. I mean, that's really, lights me up, where people feel like that after, conversations like this, they can go and talk to their spouse for the first time about something, or they start, hey, wait a minute, we had a suicide in our family, and it just starts opening up and talking about the pain. And so
Oh yeah.
absolutely, yeah. So you'll have to keep us posted with what's happening with that sweet family and everything else that
I will. I
you're
will.
doing.
So I'm trying to break up the seriousness with the fun, but it's
Yeah,
like, you know,
that's right.
I'm trying. A little bit of both, a little bit of both. You can't keep it serious all the time.
That's true.
Because people do come to TikTok for a laugh and for a light heart to
Yeah,
kind of forget about their day. I have a lot of friends that are nurses and they're
absolutely.
like they've seen COVID all day long and they just want to turn on TikTok and just
Yeah, and
laugh.
you
You know
have a
what I mean? Just
gift. You
let
have a
loose.
gift, and you have a
Yeah.
gift even that I would say that's something that I want to do better at. I mean, I don't know how you do that. a lot of people, especially the people that are kind of in the throes of it, I mean, I'll be that way, in like family events, and I'll like laugh my guts out and stuff like that. But you really do that really balanced. You really,
Thank you.
yeah, you've got good judgment when that should and shouldn't happen. My Nell's a lot like that. Sometimes even if she's in bed and she's having a pain evening, she'll still want to laugh and want me to be in that better mood, laughing at what we're watching, or whatever. And
Yeah.
I don't know. It's for me sometimes it's kind of a conflicting thing, right? Because you're like, you want to be serious about something that's serious, but to your point, you that's not always what's helpful, because that could also start causing people to feel bad, bad
Yes.
about it. And so I think that's the beautiful mix, is finding the ability to take all of that and I like when Scott, for example, gets serious, because a lot of the time he's on the side, maybe more than I, of goofy lightheartedness, laughing, and maybe a mix of him and I might be that balance. But you're already kind of there. How do you find that balance? I mean, you're probably one of the ones on TikTok that I can think of that kind of finds that good balance between what's your secret to being able to do both as well as you do.
I think I know it's going to sound, but you're a parent. As a parent, we shield our kids from, you know, what we're dealing with. Sometimes sadness. You learn how to turn it off and on really easy. Like I can be in tears and wipe them off, and my kids get in the car and, hey guys, how was your day? Like, did you have a great day? Great, I'm so happy. Let's go home and make dinner.
Yeah.
And then I come home and I go in the bathroom and shut the door and I shed a few more tears and clean myself up and I'm out the door and we're making dinner, and you have to learn to turn it off and on. And so sometimes, I mean,
I
I made a
admire
couple
that.
videos.
I admire that. I'll tell you right out. I mean, if I can have a vulnerable moment, I mean, if it's not already obvious, that's not one of my strong suits. I think that I probably can, get on TikTok and have a goofy thing here and there or whatever, I mean, I just really admire that. And I think that I would be a better person, maybe being more like that, so you're a good
Sometimes you
example
just
for
gotta put it away. I don't know. I'll tell you, I had sick with COVID, had like 103 fever, and I'm locked in this room. I can't do anything. And I was like, I'm tired of feeling this way. And I got up and I washed my face and I put makeup on and I did my hair and I shot like 3 TikToks, and then I literally like, silly funny ones.
yeah.
And then I literally just like fell into bed and went to sleep. But it
Yeah.
was like I needed that laughter. I
Yeah.
needed to be silly. I needed
I
to feel
love it.
normal for just a few hours because it made me feel better. And so I did it, and then I was back asleep, and it
Well,
was
and
what it was.
and one of the reasons why I'm also really grateful for you to join this effort is that the, the more people that have the balance that you're talking about. I'm glad we're talking about this, because this isn't something, even in all of our interviews, that we've really kind of talked a whole lot about. So I'm glad that we're talking about the importance of this. But when you can balance it as well as you do, then there's a double appeal, because a lot of people want to talk about it just for the sake of talking about it. And it doesn't mean that even in our conversations, it's just humdrum, right? It's still
Right.
a positive, uplifting. But when you add that to where, okay, now let's like take a break and let's laugh, joke or whatever, then it's even doubly, you know, drawing in, attractive to people, to where they don't shut off. And I think that's why a lot of people maybe don't talk about it, is because they don't want to feel more pain. And so if we can, be better for people that are out there trying to help, lead in any way, and having it be a positive thing, whether that's, hey, that person made me smile, that I feel a lot better, like what Scott did with what you just shared, or that was a really inspiring conversation, and I learned, that I'm not alone or whatever. then the pain doesn't seem so painful, I guess, is what I'm
Yeah.
trying to say.
Well, I've always being a daughter of a nurse, my mom used to always tell me when you laugh, you release serotonin, and when you cry, you release serotonin. You're releasing those good vibes either way, and sometimes it's got to be through tears, and sometimes it has to be through laughter. And so
Love it.
either way, you're releasing those good vibes, and so sometimes we need to cry, and sometimes we need to talk about serious stuff, and
Yeah.
sometimes we need that release, and sometimes we need to just laugh
Yeah.
because we do.
Yeah.
We just do.
And I don't think I've laughed harder when I watched Tina in her red suit, parkour, whatever she was. I don't know if you know what I'm talking about.
I know exactly what you're talking about.
I watched that over and over. I laughed my guts off. Literally her and Jack Black, in my opinion, are the funniest people on the earth. Those are when I watch those two, they're the people that I genuinely laugh at the most, and she knows that.
I love her.
Yeah.
I love her. I do. I love her. I love her. I love her.
Well, I know you have an appointment. You got to go take care of your kitties here soon. Is there anything else that you want to share with people that are watching this that they're following you for the first time about pain?
I think my biggest thing is no, you're not alone. You're never going to fight alone as long as I'm on this earth. Like, reach out to me. If I don't respond, just reach out again. Because sometimes, I get caught up with my kids and it might be a couple days later that I'll sit down and go through my messages.
Yeah.
But I try to always go through my messages and make sure that there's if there's somebody who needs something or needs me to see something or wants me, reach out to me. I just don't want anybody to ever feel alone. If you're scared, reach out to me. I'm here. That's my biggest thing that's the most important thing to me. That's why I'm on this app. That's why I've stayed on this app. I've told my story, and now I just want to be here for people. So if you need me to share something, or if you need me to, like you said, turn something purple or blue, or what, just tell me what you need and let me be a part of your story. So,
well, as I let you go, keep a heads up about the last week of this month being Chronic Pain Awareness Month. I'll be sending a Zoom invite to all of those that we've interviewed so far. And we'll be doing another Turn TikTok Purple live event, but it will be on a TV monitor with all of you guys that we've interviewed with. So if you can join that, that would be amazing.
I would love to. Yeah, I would love to.
And so we're looking forward to just having the people that we've interviewed that we've now gotten to know. We're family, right? We keep in contact with each other. So watch for that. That's probably going to be about the last week, as I was talking to Nell about the timing for this month. So we still want to do that. But yeah, she brings up a good point. I mean, just reach out to her. The things just kind of fall in place if you've got someone that cares and that you can reach out to. And I'm looking forward to continuing to follow you. We cheer you on from a distance. You don't always know and get immediate feedback. There's only so much that a comment or a like can do. But just know that people know you better than you think. People are following you more than maybe you realize, and people appreciate you far better than I think you have any clue about. And I know that that's certainly true for you, Jen. So thanks again for everything that you do. We love you. Thanks for coming on. We'll be in touch, and you go take care of your kitties, okay?
All right. I love you guys too. Thank you so much for everything.
You're welcome. See ya. Have a good night.
All right. Bye.
Bye.
I'll figure out how to do this, huh?